Hello, I'm Dr. Joanne McDonald, and I'm with Dalhousie University and the Reproductive Mental Health Service in Halifax, Nova Scotia, Canada. Welcome to one in a series of our video learning models on maternal mental health, mother's mental health. We're going to start today by talking about depression in pregnancy. Pregnancy is a time of tremendous change, and it's important to consider this when we think about the things that can contribute to a risk of any mood problem, but particularly depression in pregnancy. Pregnancy is a time of physical change, emotional change, role change in particular, and often relationship change. So a woman may have a different relationship with her family and her partner, with her friends, with her employer, and in some ways a different relationship with herself as she considers what it means in her life to become a mother. Also, there's the relationship to come with her unborn child. So depression in this setting already of a lot of change can be an unexpected experience for the woman and her family. I'd like to get you to think about what you assume the rate of depression would be in pregnancy. Is it 3.5%, 10%, 25%, or 48% of pregnant women? Well, the answer is that it's 10% of pregnant women who have symptoms of a moderate to severe nature that we would feel is in keeping with a diagnosis of major depression. Sometimes that's a lot higher rate than people realize, and it really brings home the point that you're just as likely to experience a major depressive illness in this 9-month period of pregnancy as you would in any other 9-month period if you were a non-pregnant woman of the same age and circumstance. What are some of the typical symptoms of major depression that we see when they occur in pregnancy? Well, they're really very similar to depression as we see it at any other time of life and really in any gender. However, it can be sometimes a little difficult to tease out what are symptoms of depression from the normal kinds of discomforts and changes that can occur, particularly physically, but somewhat in terms of thinking, energy level, kind of thing with normal pregnancy change. But we look for changes in sleep patterns, changes in appetite, energy, mood, capacity to cope with stress, speed of thinking, and are their daily thoughts more negative or fearful or guilty or irritable or some combination of all of those? And is their sense of connection to people or their roles with them changing? Often we'll say, are they their usual self? And that often requires some prior knowledge of the woman, but that's where her family and friends, her usual caregivers medically, can be very astute at knowing whether they're seeing a fundamental shift in the way the woman is thinking, feeling, and functioning. How do we recognize depression then from those usual changes in pregnancy? Well, we look to see that fatigue, speed of thinking or response, and the increased intensity or expression of emotion can come with the hormonal and physical changes of pregnancy, but they should improve with rest and support, not last very long, and not really interfere with function. So these last three elements are they modifiable by reducing stress or taking a break, having more rest? Are they really sort of severe and persistent? Are they getting progressively worse? And really, do they make a daily difference in terms of function? Or is a woman saying, I'm tired, but I can still push through and still do my usual activities? Depression is a more likely possibility than normal pregnancy changes if the symptoms persist and are getting worse, the emotions and thinking are increasingly negative, the experience is not typical for this particular woman, and the feelings don't seem to fit with her situation. So, is everything's really going pretty well, there are no problems in the pregnancy, no major stressors, but the woman is beginning to think more and more pessimistically about her future and to not see sort of value or pleasure in her everyday life. What are some of the risk factors for depression in pregnancy? Well, any history of major depressive episodes in the past alerts us that this might be possible for this woman. Has she had a past history of sensitivity to mood change with hormonal change, for example, premenstrually? Doesn't necessarily predict that she's going to have depression in pregnancy or after birth, but it may put her in a slightly higher risk category. Does she have unusually high levels of current stress, things that are unavoidable and difficult to change? Has she had a loss of significant supports just around the time that she became pregnant or at some point through the pregnancy? And does she have a lot of coexisting physical pain and complications in the pregnancy? All these things are considered physical and emotional challenges that may sort of reduce her natural resilience to mood regulation and mood stability. What are some protective factors? Well, if the stresses have been recent and are not necessarily ongoing and don't sort of pile on top of one another and become cumulative, that's a little bit of a better situation because it may allow the woman time to sort of strategize, deal with the things that are in front of her, and then sort of regroup to her, again, her usual self. Did she have good coping in difficulty in the past? Does she have strong support systems? That will help tremendously. And does she have a capacity to increase her self-care strategies in, the ordinary but still extremely important ways during pregnancy? So can she get adequate rest? Is she eating properly? Is she addressing any health issues that sort of come up? Is she, dealing with stresses or difficulties sort of as they come along? Does she have the pre-existing psychological insight into her own self and her coping style, and does she have the skills then for resilience? And does she have a high desire and motivation to parent? Because certainly if a pregnancy is unplanned or occurs in a circumstance of conflict, trauma, or difficulty, the woman's perception of her experience of pregnancy as well as her capacity to sort of sustain herself through difficulties may be clearly different. What are our approaches to intervention in depression and pregnancy? Well, interpersonal and cognitive behavioral psychotherapies can be very effective as standalone interventions or treatment for those with mild to moderate symptoms, and the woman may be able to avoid the use of medications in pregnancy. However, untreated severe depression is associated with very poor outcome for mother, both obstetrically in terms of the chronicity risk for depression or other psychological illness for her, and also in the ongoing development, both emotionally, physically, and cognitively for her unborn child. So medications are reserved usually for severe symptoms, but used with evidence-based trials and the knowledge of safety and relative risks for that particular woman, and should be used with monitoring by a physician who's comfortable and familiar with the evidence around safety of medications in pregnancy. Family and friends, though, can never be underestimated as to the importance of their support and their involvement, both in terms of practical care of the mom, reduction of the stigma for her around having to look at assessment and treatment for depression at a time most families hope will be a happy event in pregnancy, but also support for her in weighing those risks and benefits and decisions around intervention and treatment. What's the outcome for pregnant women with a depressed mood or a depressive illness? Well, not all women go on to have postpartum depression. A small proportion of cases will actually seem to improve with delivery itself, so that the increased hormonal load of pregnancy seems to be the trigger for those particular women. But safe and successful treatment of depression in pregnancy will certainly limit the risk of subsequent deepening of the depression postpartum, or for women, the risk of a new illness in the sort of postpartum period. Sometimes people are tempted to sort of have treatment until their symptoms are just barely reduced and then come off the medication, sometimes abruptly. But this practice can lead to greater risks of relapse and a recurrence of the mood disorder, both within the pregnancy and postpartum period, but also sort of lifelong. So again, a considered decision around treatment, good monitoring, and safety considerations will predict success for the mother and the baby. Treatment, we know, also enhances the woman's function in labor and in attachment postpartum. So depression in pregnancy, really, we have a number of goals, which is for the mother to have a successful experience and make this adaptation to this important time in life successfully. Some general considerations in treatment are that we should try and reduce stressors whenever possible, increased rest, moderate exercise as appropriate for her medical status and nutrition, bring in practical and emotional supports, seek out mental health assessment where it's available, consider psychotherapy again where possible, and discuss the benefits and risks of any risks and benefits of any medications recommended. An important resource for anyone in the community and for women and their families is motherrisk.org, which is a source with the Sick Kids Hospital in Toronto, Canada, of any kind of medication really that a mother might be exposed to in pregnancy, and has the latest research results on what the relative risks and safety are of any given substance, including psychiatric medications. So some points to remember are: pregnancy doesn't protect women from depression. Self-care and psychological strategies are key. Medications can be used in severe cases with safety and monitoring. And we have resources to evaluate the safety of any medication that a mother might be exposed to in pregnancy. And successful treatment of depression in pregnancy is critical to the new mother's function when the infant comes. Thanks again for watching our learning module. It's one in a series developed by the Mother's Mental Health Toolkit project here in Halifax, Nova Scotia. Our aim is to promote knowledge and advocacy in mother's mental health through frontline support and service providers.